Dear friends, welcome to the show Talk with Your Doc. I am Dr. Prashant Jani, and with us is today Maheen Cassim. She is a dental hygienist practicing in Thunder Bay, Ontario, Canada. Today we are going to talk about oral hygiene or dental hygiene. Poor oral hygiene can lead to missing teeth, oral ulcers, oral infections, or even oral cancer. And hence it is very important to take oral health because some of the oral problems can be really serious. And Maheen is going to guide us about how we can take care of our dental hygiene or oral hygiene and answer some of the frequently asked questions. Thank you, Maheen, for being on the show.
Thank you for having me here today.
Please tell us about how one can take oral health or dental health. What is oral health and what one should do?
So oral health, when we talk about the mouth, it's it's our teeth, it's our gums, it's our saliva, and it's all connected to the rest of our body, right? So it's like how are we going to maintain it? So there's, of course, we all heard about brushing and flossing and rinsing, but it's the frequency, it's the technique of how you do things. So it's not just about taking a toothbrush and just scrubbing our mouth, right? It's how we utilize those tools. So you have electric brushes, you have manual toothbrushes. It's a combination technique, and it's based on each individual need. So what I may propose as an oral healthcare plan for you may not be the same for me. So your dental hygienist is able to guide you depending on your needs and how much plaque, bacteria, your gum recession, and what's present in your mouth based on the assessment.
So for the oral regular health, one should visit a dental hygienist or dentist?
So this can go both ways, you can say, but you have dental hygienists who work with a dentist, and then you have a dental hygienist who work independently as well. So when you go to a dental practice, you would see, it's always a dual treatment plan, right? So you cannot say, I will only see one person. So they both are involved in your dental treatment. And if you're basically gum-related disease is more related with dental hygienist. If it's a hard tissue disease, then it's more related with the dentist. So it just depends on what the person is needing at that time.
So what are the common or earlier signs and symptoms of poor oral health?
So poor oral health, if you look at it, so if you're suffering from a lot of bad mouth odor, so that's called halitosis. Those could be one of your signs and symptoms. If you have bleeding gums when you're brushing or flossing, that is one of the major signs and symptoms as well. Always look in your own mouth. The best person to observe your own health is you yourself, right? So look for signs like something that's growing in your mouth, or you find a spot or a lesion, and it's been there for a while. Go see your practitioner, your dental hygienist.
Like a white patch or something?
A white patch, a red patch, or even if it's just slightly discolored from your normal mucosal color, then take signs and symptoms, be aware of these poor
Sometimes
things.
we tend to ignore a little pain in the oral cavity.
Yes, absolutely. We say, oh, it's just nothing, it'll go away. But sometimes it could be, deep-rooted. So it could be below the gum line, and it could feel just like, I'm just sensitive a little bit, but could be more related to decay.
Maybe cavity.
Cavities, yes. So it's initial cavitation formation.
What is cavity?
So cavity is the breakdown of your tooth structure, right? So that's what we call caries. So how does it happen? It's the bacteria that sits in your mouth. And because we eat all lots of delicious carbohydrates and sugars on high consumptions on a daily diet, the bacteria acts on these sugars, and then they produce an acid. So the acid eats our enamel, and it causes a demineralization process. Now, demineralization is happening all the time, but we also have our saliva, and that's our fighting agent. So they fight the bacteria and help them out to come back to remineralization state, right? So it's a constant battle, but if we don't take care of our mouths, then the decay can progress in the second.
So it's the food which is stuck between the teeth, is that?
The food is stuck between the teeth. It can be just sitting on your gums. It can be sitting on your crowns. It can be sitting on your bridges. And if we don't take care of it, remove it mechanically, physically, it will stick, and then the bacteria produces a sulfur, right? So the dead bacteria produces sulfur that causes the decay and the acid erosion in our mouth.
So once the cavity is formed, then it will cause a lot of pain, sensitivity to hot and cold?
Yes, so you can have symptoms like hot and cold sensations. You can have sensations with sweet or sugar. So you should be aware of these things. So if you're more hot and cold on a regular basis, you can sometimes pinpoint the region. Sometimes it's like your whole side of your face will hurt. So it can lead to, just could be a regular cavity, could be a root canal issue. So you don't want to go to root canal, then there's more tooth structure involvement, right? So you want to be aware. But don't neglect these things, right? Don't say, it'll go away, I'll take some Tylenol and go away. It's not about taking a Tylenol.
So how do you treat a cavity? Like you do some filling or?
So if you have a cavity, then we would refer you to the dentist, and then they remove the decay, right? They excavate the decay out, and then they do a filling. Now the filling can be, depending on where the cavity is, you can have a silver filling, you can have a gold foil filling, you can have a composite resin, you have a glass ionomer. So there's different filling materials that they can use.
And who decides the material to be chosen?
The dentist will.
Dentist will.
Yes, because he'll see your occlusion, your bite, your how, where the fillings in the front part. Like I'm sure none of us would like a silver filling in the front. We would like a white restoration.
Yes.
Depending on the back, if you're a hard biter or a grinder, they might do a silver filling because it's still more durable.
Right.
So it just depends on the patient and what they're.
So how frequent one has to go for filling? Like once cavity is found, then?
Oh, so if it's a filling, it might be just one appointment.
Okay, and
yes.
then how long it lasts?
It can last, nothing can last forever, right? But we generally say 10 to 15 years, but it can go longer too, yeah.
About the toothbrush and toothpaste, would you recommend what type of toothbrush to be used, what type of toothpaste to be used?
So I'll talk a little bit about the toothpaste first, and then we'll go to toothbrushes. Okay, so the toothpaste, there's regular toothpaste, which are, there's a number of brands available, and then there's sensitive brands available. So if you have no extreme sensitivity, on a regular basis, because sometimes we have recession in the mouth that causes sensitive,
pain,
right? So even though you may not have decay there, but you're sensitive. So for those individuals, we recommend using a sensitive toothpaste to help control the amount of fluid transmitted between the nerve endings.
So what does this special type of toothpaste do?
So the sensitive toothpaste has two folds. Either it will block the tubules of the teeth, right? Or it will stop the transmission of fluid between that flows between the dentinal tubules.
It becomes like a layer on
like
top?
a layer on top.
And then it doesn't cause any pain or sensitivity?
Exactly. Yes, it prevents the sensitivity level. So saying that, if you go and buy a sensitive toothpaste, is that bad? No, it's not, right?
Okay.
You can still do that. Or you can use a regular toothpaste. Now, which brand you pick up does not
How does
really
a regular
matter.
toothpaste act on your teeth? What does it do?
So regular toothpaste, what it is, normally a lot of toothpaste have sodium fluoride in it. Okay, so when the sodium fluoride, you take a toothbrush and you brush your teeth with it, it acts with your saliva. So, and your saliva has certain components which it combines with, and it forms a fluoroapatite crystals on your teeth. So kind of like a protection against the teeth. So it prevents the bacteria from constantly attacking. So it forms like a remineralization process going on.
So if you brush without toothpaste, it doesn't work?
You will probably still remove mechanically. You'll remove biofilm. It's not that, but the protective layer will not be formed.
Will not be formed.
Yes.
So it's important to use
It's
the
important
toothpaste.
to use a toothpaste.
Now, what is the role of fluoride in the dental health?
So that's the role of fluoride, because this is when we said how it forms the protective health. It's the fluoride that's in these fluoride toothpaste. Yes, and that causes binding with the molecules in your saliva and causes these fluoroapatite crystals to form, making a hard covering on your teeth as well.
Thank you, Maheen. We'll take a short break and we'll continue our talk.
Sounds good.
Please stay back for the next part of the discussion. We'll talk about use of toothbrushes. Thank you. Welcome back to the show Talk with Your Doc. Today with us is dental hygienist Maheen Cassim, and we are talking about how to take care of our dental or oral health. Maheen, we were talking about use of toothpaste. Now please guide us about the different types of toothbrush and which is recommended.
So lots of different kinds of brushes. Okay, so you have manual toothbrushes and you have electric toothbrushes. Again, in manual you have soft, medium, and hard. We always recommend using a soft toothbrush. Okay, it's not about the force, it's the technique of how you brush your teeth. Okay, so we guide you how to brush your teeth with a proper technique. Lots of different techniques available, again, based on each individual client. So for kids, we may do a circular. For adults, we may do a modified Stillman's technique. For someone who's senior with a lot of recession, we may have another technique. Again, always use a soft Bristol
Soft
toothbrush.
toothbrush. And the technique, how can one learn technique?
Technique is being taught by your dental hygienist.
dental hygienist.
Okay, so once you go for your regular teeth,
Is there any website that shows information about it?
there are techniques that you can see. However, it's best if you're guided, because what you may think maybe for you may not be really working for you,
Right.
because then it's monitored, right? You go for an appointment, we guide you, use this. 6 months, 9 months later, you come back, and then we'll say, did it work?
Yeah.
So we can base it. So then we can adjust it. So if
So soft toothbrush you recommend?
always a soft toothbrush.
How about mechanical versus the?
So electric toothbrush
Electric.
or the mechanical toothbrushes are great brushes. Okay, again, there's two different kinds. One works with a circular motion. One works with like a vibrating motion and like a more sonic kind of an appearance. Which one you pick up and why, again, will be decided by your dental hygienist when you are there.
Yes.
And why they create, because suppose if you have arthritis, if you have recession, or if you are undergoing orthodontic treatment, these brushes are great. Or if you're a hard toothbrusher, so if someone is taking their regular soft toothbrush and scrubbing away their their teeth and
the gum
mechanical,
release,
exactly, you're calling mechanical abrasions on our teeth,
Yeah.
recessions happening, what are we causing? Sensitivity. Right? So we're just adding decay, bacteria can stick to it, plaque can adhere to it. So we don't want to cause those
So
damages
in those
our
cases,
teeth.
electric toothbrushes.
Electric toothbrushes are way better.
Yeah.
For something. You get a standard generated force. The new brushes are great because they have this red light built in them, or some kind of a light that comes on if you exert too much force.
Right.
So if you're someone like me who likes to brush hard, I like the electric toothbrush because it tells me,
Right.
release the force in your toothbrush.
And one should brush twice a day? Or how often one should brush?
Twice a day is recommended, morning and at bedtime, and flossing once a
Flossing,
day.
how often one should do flossing?
At least once a day.
Once
So
a day.
recommended again at night, and again rinsing after you brush, floss, and rinse.
What is the role of rinse or oral wash?
So rinsing, there's two different kinds of rinses. Okay, one can be just therapeutic, right, and one is just to cleanse your breath, kind of thing, or people will use it just to have a fresh, feel or taste in the mouth. What is the role for rinse? If I take a rinse right now and just put it in my mouth and swish around, it's doing nothing, okay? Because only if I disrupt the biofilm and then I rinse and expel it, that's how it works. So you need a mechanical disruption of the biofilm. You take the rinse, and so it decreases your bacterial count, so it keeps it to a lower level. And that's how it helps to
So
enhance.
when one should do the rinse?
The ideal time would be at night.
Night time.
Yeah, after you brush, you floss,
Okay.
and then you rinse.
Are there any different types of rinses or mouthwash?
There are, like I said, you have the ones which are medicated, which are only being prescribed at a clinic. So you would, if you have halitosis or if you have high gingival bleeding counts, then you would be given a chlorhexidine rinse. Otherwise, if you don't have any of the above, modalities, then you can use a regular mouthwash, and that you can buy
Should kids
commercially.
use the mouthwash?
Kids should, depending on the child and their ability to spit and rinse, if they can understand that. You have children's mouthwash. They're great for caries, and they have a high fluoride index. So if you're high risk for caries, they're great. So they should not use an adult mouthwash, but they
Okay,
should use a
just
kid's
special
one.
kid.
Yes.
Can you guide us about the whitening of the teeth? How one can do it? Should one go to the dentist for whitening or buy the over-the-counter whitening stuff?
So this is one of my favorite topics, actually. Whitening is, you can have lots of products available, okay? Any whitening product will work, whether you use something off the shelf from a store, or whether you, go to
Dentist.
a dental office, or sometimes you see whitening places at airports and stuff too now, right? Like
So what is the difference?
So it's a concentration of the gel.
Okay.
Okay, it's the potency of the gel. So a whitening product is made up of hydrogen peroxide and a carbamide peroxide. The carbamide is more water soluble, and a hydrogen peroxide, as you know. So something that is dispensed to you at home has a lower hydrogen peroxide level, right? So the effectiveness, the longevity of the product, how long it lasts, how much it'll affect, will be different than something which has more water soluble.
Okay.
And which is the carbamide. So, the hydrogen peroxide. So lots of options available. There's some great options available at any dental clinic that you would go to, and they have in-office whitening treatments. They have take-home whitening treatments. Are you a best candidate can be judged on your appointment, where your shade guide is. They will evaluate where you're starting off, which procedure will you be more compliant with? Like, would you do something at home? If not, and if you don't carry the procedure properly, then it's wasteful, right? So then you would be better to do something in office and get it done.
Somebody told me that sweet and ice cream is not good for your oral health. Is it true?
What do you think?
Like chocolate, somebody said not to eat chocolates.
I wish someone would not say that. but you know what? It's the frequency of intake. Okay, so yes, these are high in sugar and high in carbohydrates, and bacteria, love these things. It's like a party for them when we eat any kind of sugary stuff. It's the frequency of eating these. So if I eat something at night and go to bed, it's going to be a party in my mouth.
Oh, yeah.
Right?
Because the bacteria will grow.
The bacteria will grow. They're going to sit on my gums. They're going to sit on my teeth. My tongue is
it's
the
medium.
biggest media for them to grow and get activated. So it's, if you are eating and then you wait half an hour and then you go brush your teeth, that would be great. Yes, restricting you. If I say no to you, you will go and eat that. So it's how and when you eat it. Introduce these things maybe after your lunch or dinner, right? Have it as your treat. Like, okay, I'm going to have my little piece of chocolate today.
And then have a toothbrush.
And then, but always wait at least minimum half an hour before you brush. And the reason I say that, when we eat or drink anything, it decreases our pH balance. So it becomes more acidic. Now I take my toothbrush and brush, I'm causing mechanical wear in my mouth. So I don't, that's something you shouldn't be doing. So you're causing abrasion.
Half an hour after the dinner.
Yes, and why? Because when your saliva fights the pH balance and brings it back to neutral, and then it's good to brush again.
Right. Now, smoking and care of the oral hygiene, how do we go about it?
So smoking, again, is one of those factors that is big cause for oral cancer as well, right? So it has a negative balance in your mouth. So with that, you constrict your blood vessels, and so the gums don't breathe. When the gums don't breathe, then the bacteria can grow more. And then you can, it grows via your bloodstream to the rest of your body as well, right? So, and then there's negative pressure, what causes dryness of your mouth. It also causes burning sensations. So big growth for oral cancers. That's why we always say, check your mouth, check your lesions. If you are smoking, try and quit. There's lots of programs that are available. So we always try and refer to these programs. We have a lot of smokers have dry mouth, so we'll help them with their dry mouth sensations and how to overcome them. Lots of things available now, right? Sip a lot of water, over-the-counter products, take-home products, so we'll guide them through that.
Thank you, Maheen. We'll take a short break and we'll continue the last part of the discussion.
Sounds
Please stay back for the last part of the discussion for today's dental health program. Thank you. Welcome back to the show, Talk with Your Doc. Today we are discussing about how to take care of our dental health or oral health, and Maheen is helping us to understand different problems. Maheen, we were talking about smoking and the disease, oral disease. Now, can you please tell us about the relationship between oral hygiene and heart disease?
So there's a lot of correlations between oral hygiene and, over time we've had more and more research that's come out. And both these conditions are based on inflammation, right? So inflammation that is in the mouth, and again, heart disease based on inflammation. So you have plaque, bacteria, and constant inflammation. It's going through your bloodstream into the rest of your body, and that's how the correlation is linked. Now, someone who is at high risk for getting familial history of heart disease, again, they're high risk, so we monitor them closely. We bring them at shorter intervals for, removing the inflammation from the mouth. That may be a causative factor, or maybe linked somehow. So we don't want to be like leaving something in the plaque, bacteria, and then this gram-negative bacteria below the gum line that will cause these, extreme factors that can cause increased risk for these things.
So somebody having the heart disease history has to take special care of the oral health.
Yeah, and
has to visit frequently.
Frequently, yes. So the
dental.
frequencies are based on certain conditions of your mouth. So if you have high inflammation or gum disease, bleeding counts, you have a high, probing depths are big in numbers. That means you're more recession. So you're more prone to inflammation and infection. So your recare intervals will be based on those needs and factors.
So there's definitely some relation. Now, does any oral medications or drugs affects the oral health or dental health?
Lots of medications. So if you have your last visit to your dental hygienist, he or she will always ask you, what medications are you on? And the reasons we ask these questions is like, if you're any kind of antihistamines or decongestants or medications for breathing respiratory problems, a lot of them cause dry mouth.
What is dry mouth?
Again, dry mouth is euxerostomia is what we call the technical term. You wake up and you feel like there's no saliva in your mouth. So it's very important to control that.
So your mouth sticks. And
It's sticky saliva and your teeth become brittle. You're high prone to decay and disease.
And then you smell.
And you can have a bad breath. So it's all like one thing leads to another, right? So we want to control these medications. So when someone is taking inhalers and puffers for asthma, we'll say always rinse your mouth with water after. There's all these chewable tablets, I shouldn't say candies, but chewable tablets that you can eat with xylitol. These are natural sugars that help your saliva flow. There's lots of other products that we can recommend. We change the toothpaste or certain special toothpaste for dry mouth. So we'll change all these things based on the needs. So it's kind of important to ask these questions because sometimes they'll cause dry mouth, sometimes they'll cause inflammation. So we need to know what are the factors that is, you're saying you're brushing and flossing, you're doing everything we're asking you to, but still there's lots of bleeding. So where is it coming from, right? So these are important.
Would you have some recommendations for seniors, dental hygiene or oral hygiene?
Absolutely. Seniors should obviously continue visiting their dental hygienist for health care and getting their oral health care under control. If they wear dentures, then they should remove their dentures every night, soak it in water. You also have certain pills that you can put it in effervescence like polydents, and then you can get their dentures clean. Look at their gums, see if there's any soreness or dryness under the gums. Is the denture fitting or is it ill fitting? So we can refer them basis what we need, right?
So how often a senior should visit dentist or dental hygiene? Again,
this is very specifically individual client based. So if their oral hygiene is generally on the poor side, if they suffer from dry mouth, if they have a lot of recession, then we would advise them to visit every 3 months or 6 months. So based on that, we will.
And about the average, individual, how often one should visit dental hygienist?
Roughly, it should be every 6 months.
Every 6 months.
Yes, but sometimes, again, if your bleeding count is high and everything, then we'll bring you back every 3 months. But then we also have clients who come every 9 months. So we will base it on each individual client's needs.
I see a lot of people having oral piercing. It might be cosmetically looking different. But is there any effect of that oral piercing on the oral health or dental health?
So if someone has an oral piercing, my recommendations would be to clean your oral piercing take a toothbrush and brush around it. Actually, if they can remove it, that would be the most ideal. So then they can, and then brush their tongue. So it's the plaque and the bacteria that develops around that little appliance in their mouth will cause the growth of bacteria and other oral cancer conditions that can happen.
So they can lead to infection or cancer?
Absolutely.
So one should take care of it?
One should take it out if they can. If they can't, then they should try and clean around it or take a gauze and wipe around it for sure.
Okay. Now for the bad breath or halitosis, would you recommend some precautions for it?
I would say drink a lot of water, sip water daily if you can. Use sugar-free gums. You can chew that. You can have sugar-free candy. There's a lot of brands available. If you have conditions that are not going away with just oral hygiene, daily oral hygiene maintenance or your dental hygiene basis, then there's an underlying factor.
Does chewing gum helps to take away the bad breath?
Chewing gum can, It can a little bit, but chewing gum helps to increase saliva.
Okay.
So when your saliva is increased and your mouth is self-cleansing automatically, right? So your saliva has a huge role to play in your mouth. So that's why we need a good production of saliva all the time. So don't complain if you have a lot of drool in the morning. But yeah.
Does mouthwash prevent the oral smell or bad health?
It can mask it a little bit, but it does not eliminate it. So it's an adjunctive factor, but it's not the causative agent to help you replace all these things.
Can you tell us some brief about the braces? Children use, like young people use a lot of braces.
So
brief about it.
braces is...
Why do we use it? What are the advantages?
So what are the advantages of braces? Why do we recommend braces?
Yeah.
Okay, so if we have a child and we're looking at their bite and their occlusion, and if it's have a malalignment in their jaw, we refer them to an orthodontist, right? So they will decide the treatment plan from there. It's great, it's good to actually, if you have a malaligned joint, to get braces and repair your dentition smile. It's not just for aesthetic reasons, it's also for like grinding, clenching, biting, for future, for the eating and, daily hygiene maintenance. Helps to control the, cleaning. If they have a lot of attrition or they have a lot of crowding in the front, then it's hard to brush your teeth in those areas, because brush will not just go at every angle. Sometimes you've got to be very creative.
Right.
So we recommend getting braces to fill that, to fix that issue. And when that happens, all of a sudden your hygiene becomes better too. So there's a lot of reasons why they go to get braces. But then when they have braces, they also have to realize they have to do a lot of maintenance at home.
Yes.
So it's not about me just going getting braces and being, hey, I'm done.
Right.
Brushing technique has to be absolutely at your A game. Your flossing has to be good. Your maintenance interval have to be every 3 to 6 months. So you're in a different kind of a treatment plan altogether, right? It won't be applicable for you, but it has to be a rigid kind of a treatment plan to watch these young kids brush, because we all know teenagers don't really like brushing. So you've got to like encourage them how to brush and keep it healthy. Otherwise you end up with cavities, and you can end up with recessions, and then it'll lead to a different problem altogether.
Thank you, Maheen. You give us a lot of information about the dental
You're
health.
welcome. Thank
Is
you.
there any website you recommend to?
I would recommend
more
there's
information?
there's a great website on odha.ontario.ca. They have Love My Teeth for life, and they have all these great literature over there for fact sheets for you to use and for people to see and learn more information on.
Thank you for your time.
You're welcome.
Thank you for joining to the show.